Welcome to another presentation from the CV Academics Foundation, home of the AMP Honors Program.
Hello everyone, I'm Alexis and I'm a super mentor here at AMP, and I'm excited to introduce you to a great friend of mine, Abby, who is currently a Doctor of Physical Therapy student at Missouri State. How's it going, Abby?
Good.
Cool. Mind if I ask you a few questions?
No, please do. I'm excited to be here.
Awesome. All right. What is a physical therapist?
So, a physical therapist, we're medical professionals and we work mostly in the realm of movement and physical health. So we don't work with medicine at all. We work a lot in like the neuromusculoskeletal systems, and we focus mainly on the functional capacity of movement. So that includes not only how well somebody's able to do something, but if they're able to do it in a way that's sustainable and won't cause injury in the future. So that's kind of a very general overview of what we do.
So how did you become interested in physical therapy?
So throughout like my childhood and early adulthood, I was exposed to physical therapy through a lot of family members. So, you know, my grandpa had a stroke and I worked with physical therapists, and my dad broke his knee and I worked with physical therapists, and I broke my wrist and then I worked with physical therapists. So just little interactions throughout my whole life, but all of those tiny interactions had a huge impact on the lives of the people that I loved. So that's kind of what drew me to it, was just the focus on commitment to their patients and time spent with their patients, and these little things that had huge impacts on people's lives without medication and surgeries and stuff like that. So I was really drawn to that, and that's what got me into it.
Cool. Yeah, I definitely remember you breaking your wrist. So that was, yeah.
Yeah, it was a good time.
It was a fun x-ray though. I enjoyed looking at it. What does being a Doctor of Physical Therapy student entail?
So actually the day-to-day stuff, it's not much different than any other, doctorate program. You go to school, you sit in lectures, you do some labs, you might work in clinic a little bit, and then you go home and you study a lot. But I can kind of talk a little bit about what the program as a whole is like. So PT programs are usually 3 years long. You do have 3 semesters a year, so you do go through the summer. You usually start out with a year of coursework, which includes like your basic anatomy, your musculoskeletal testing, your neuroanatomy, and your kind of medical background, what you do need to be a physical therapy student, you get in that first year. So it covers really the basics of it. After that first year, depending on your program, you might start to get into the clinical portion. So in our program, we have a clinic in our school that you start your first year, but then at the beginning of your second year, we actually go out on a clinical that's just 4 weeks long. Throughout the course of our entire 3 years, we have 6 clinicals that we go on, and we need to have a clinical in an outpatient setting, in an acute setting, and in a rehab setting, which I think we'll get to a little bit later. And then you graduate exactly 3 years after you start. So the May 3 years after you start. It is pretty intense. We usually do classes from either 7 or 8 in the morning to anywhere from 3 to 5 in the evening. So it can be some really long days, some pretty intense studying, but it's really worth it.
Right there. So once you finish all of that lovely schooling, what are your next steps once you actually have your Doctor of Physical Therapy degree?
So once I get my degree, I still have to pass the licensing exam to be able to practice. So that's step number 1. And then after that, I have to decide what setting I want to practice in, because physical therapists typically specialize in one sort of area or another. I can wait a little while to do that and just kind of practice general practice for a while, but I'm thinking right now that my next step will maybe be to travel a little bit. So there are travel physical therapy organizations where you take temporary placements all over the United States, and you can travel between them. And it's not only good for being able to see a lot of the United States while you're working, but it's also good to get more experience in more settings that you might not be able to see during school. So then I can really decide where I want to settle in the field of physical therapy.
Yeah, that does seem like a really good way to get a wide range of experience, and even with different populations of people too.
Yeah, definitely.
So you mentioned there being a wide range of settings and specialties within physical therapy. Can you describe some of those and what those might look like?
Sure. So there are a few different settings. The first is outpatient, and that's what a lot of people think about is the outpatient orthopedic. So you break a bone or you sprain your ankle or something along those lines, and you go to outpatient therapy for 4 to 6 weeks, you get better and you move on with your life. That's kind of the basic outpatient. There's acute. So people who have acute diseases or injuries who need some medical attention, we evaluate them and treat them to help maintain or return to function. Most of that includes things like being able to stand up from a chair, being able to walk, training with an assistive device that they might not have used before. There's rehab, where people go when they have more of a long-term debility because of a disease. So you'll see people who had heart attacks or strokes, and they have to really relearn movement. Those people get 3 hours of therapy a day, and usually the goal is for them to return home. So they usually don't go to an assisted living or nursing home, which is really cool. There's a SNF, which is a skilled nursing facility, and that is a nursing home where physical therapy is also provided. It's a little bit less intense than a rehab facility. And then you'll also find physical therapists in schools, and they work with children in the schools who have disabilities, and they give them the equipment they need and the physical attention that they need in the schools. So that's a really good way to be able to get everybody, every kid that needs physical attention. It helps them fulfill their needs regardless of their financial situation. And then there are a few different specialties, and you usually find most of these in outpatient, but you can also see them in inpatient areas as well. You have vestibular, so they work with balance based off of the inner ear, and also some vision as well. You have neuro, so those could be traumatic onset, like a car accident that gives you a traumatic brain injury, a stroke. It could be adult onset diseases like Parkinson's disease or Huntington's, or childhood onset diseases like cerebral palsy. They do sports medicine, so you will see physical therapists on the sidelines at high school, college, and professional level athletic events. Pelvic floor therapy for people, especially women who have injuries there from trauma or from giving birth. That's really important to help with continence and pain in that area. This one is not quite as common, but you will see physical therapists in emergency departments doing musculoskeletal consults. So if somebody comes in with something that seems like an ankle sprain, instead of doing a lot of imaging and a lot of testing, they'll have a physical therapist do a consult. They do pediatrics, aquatic therapy, which is really great for people with muscular long-term disabilities, and then manual therapy. So kind of moving people for them. So to help with a lot of times pain. So that was a really long list of things, but those are only just some of the areas that you'll find physical therapists. We really are diverse and can do a lot of things.
That's awesome. I actually did not realize that schools had physical therapists.
Yeah, a lot of times a school district will have a physical therapist. So they will travel from school to school, but they're really, really vital to making sure that patients, or children in this case, have access to a good education despite their physical disabilities.
Great. So what is your favorite and your least favorite part of being a doctor of physical therapy student?
My gut reaction about the least favorite part was to say studying. But no, I actually do enjoy some of the studying that I have to do, and the kind of conversations that it brings about with other students. My favorite part would be the relationships that you're able to form. I kind of touched on this earlier, but my class is a class of 42. So we are always with each other, always doing things, which can be kind of a hassle sometimes, but most of the time it's really great and you really get to know your classmates. This also means we have a rather small faculty. So we're really close with our faculty. There are a few faculty members who I could call at any time of the day and I know they would pick up their phone. And then you get really good relationships with patients. We do have a clinic at our school where we see patients continually, and these patients usually need long-term care. So these are patients who have been coming to our clinic for years and probably know the clinic better than I do. So that's really cool to see their relationship with the professors and then form relationships with them as well. And relationships with other physical therapists. We have 6 clinical internships throughout our program. And so we're able to really get to know the therapists that we work with on these clinicals and form some really good relationships with them. My least favorite thing would probably be learning about like the political side of physical therapy, because healthcare is private, which has its pros, it also has its cons. And part of that is the insurance and the laws that kind of go along with that. And it can sometimes be frustrating because it can disrupt patient care, which is really why I want to be a physical therapist, to be able to give these patients what they need and help them achieve their goals, which are sometimes as big as like learning to walk. This is big stuff, but you have to learn about all those insurance politics things, and it kind of clouds your thoughts on patient care. So it's a little frustrating, but also a necessary evil in this case.
So those have been all really awesome answers so far. Anything else you'd like to add or share with the AMP Honors Program students? Any words of advice?
Yeah, I would just like to encourage everybody to really think about your options when looking at a career in healthcare. As you can see from what I said earlier just about physical therapy, even within this one domain of healthcare, there are so many different options and things you can do. So really explore that, ask questions, call clinics, ask if you can shadow. That's a little bit more difficult with COVID, but you do some virtual shadowing through AMP. So, try that. Really try to connect yourself with other people and figure out what's out there, because even if you're like, wow, I'm really drawn to the medical field, but I could never be a doctor, or I hate blood. That's one of the reasons I didn't go into the medical side of healthcare, because I don't do well with blood. There's always something out there. There's something that will interest you if you're interested in helping care for other people and care for their physical needs as well as their emotional needs that are associated with that. So really, really get out there and see what's out there and find where you fit in.
Super great advice. And like I said, great answers to all the questions today. So Abby is on the platform. Make sure you reach out to her with your questions. I'm volunteering her for that. She's a great resource.
No, I would love to hear any questions regarding physical therapy, about being a student in a professional program, about the application process for physical therapy school, any of that. I'd be more than happy to talk with anybody about that.
All right, great. Students, take her up on that. Well, thanks again, Abby. This has been awesome.
Thank you.
This has been a presentation of the CV Academics Foundation, home of the AMP Honors Program.